Why add bone powder for optimizing PMMA into bone cement? What's the point of doing that? Hi, I'm Ye Song from Origins Medical. In this episode, let's break this question down clearly. For vertebral compression fractures, the most common procedures are PVP and PKP, and both involve the use of PMMA, bone cement. The clinical value of bone cement is very clear. It works fast, builds support quickly, stabilizes the vertebra in a short time, and helps patients relieve pain sooner. So, from a clinical benefit perspective, PMMA has long been a very natural and widely used material. But no material is perfect, and in clinical use, there are usually two issues concerns with PMMA. The first is its relatively high elastic modulus. It provides strong support, but it may lead to secondary fractures in the adjacent vertebrae, with a reported clinical incidence of 12.4% to 27.7%. The second is limited bioactivity. It has poor biocompatibility and cannot achieve osseointegration, which may lead to loosening or even displacement within the vertebral body. And adding bone powder for optimizing PMMA is one targeted way to address those issues. Let's look at the first evidence, the change in mechanical performance, using osteoporosis V as an example. After adding the bone powder for optimizing PMMA, the elastic modulus can be reduced by up to 36% in an ideal setting, while compressive strength stays basically unchanged. This result is important because it shows that we are not just making it softer, we are making it better balanced, strong enough to support, but more in tune with the spine. We are making the mechanical behavior closer to what clinicians actually want. The second evidence is the change in osseointegration. In bone ingrowth comparisons, after adding the bone powder for optimizing PMMA, clear bone ingrowth can be seen at both 12 and 24 weeks, where pure PMMA shows no such bone ingrowth on the surface. That means it's not just about filling and supporting. It's also moving toward better integration with surrounding bone tissue. So back to the question, why add bone powder into bone cement? The core purpose really comes down to two things. First, to lower the elastic modulus. Second, to improve bioactivity. In the next episode, we will use real clinical cases to show how bone powder for optimizing PMMA is actually used in practice.